What is your electric bill in this whole facility per month?
That's
It's around 7 million.
So in a year you're talking about 100 million.
90.
90. You know that if you did a solarized system in this place, which is 4, right?
Yes.
You wouldn't spend even 20 million to do.
Well, we started with the boreholes. So we are hoping.
The reason I'm asking, all these lights are here. We are here because
Especially daytime lighting.
we discourage.
Stories zimekuwa mingi.
But this is part of the store tutaenda. Yes.
Tuambie kwa kifupi.
Pengine nyinyi ndio mniambie, nyinyi ndio wageni wetu. So this is the main store. So the items are received from, we have a receiving area where the door is on that side. So tuko na watu wanakagua. Yes. Oh, sorry. My name's Dr. Lydia Wanjiro Gituro. I am the pharmacist in charge in this facility. So I'm in charge of 7 pharmacies that are within the hospital. I have.
This is the main one.
This is the main pharmacy that runs 24 hours, including the weekends na usiku. The other pharmacies are just satellite pharmacies that run Monday to Friday, 8 to 5, or on any other special occasion as per need required. But this is the pharmacy where you come any time of the day imefunguliwa and you can get all the services. So in outpatient casualty pharmacy, we have oncology pharmacy, we have maternity pharmacy, chest clinic pharmacy, and we have inpatient pharmacy that serves the wards.
So let me understand.
Yes.
So is this a dispensing pharmacy?
Yes. In casualty, it serves the casualty.
Okay.
Tutaenda hapo mbele. So this is still a dispensing pharmacy. Yes. This was the main pharmacy.
Okay. So where is your store?
Store
where
iko.
you receive?
Yes.
Ndio iletwe hapa for dispensing.
Iko warehouse.
Where?
But sasa warehouse wana receive alafu wanatuletea yote in bulk. Like you can see the way our tablets are.
No, it's okay.
Yes.
Where is that?
Hiyo warehouse iko huko. Wapi? Chini huko chini. So some of the bulky
within
things.
The facility?
Yes, within the facility. So ikireceiviwa huko inatransportiwa hapa. Alafu tunaingiza kwa the necessary documents and then now we issue. We issue to all the satellite pharmacies. So this is the main issuing area.
Chair,
Yes.
using the barcoding you are supposed to implement. How far have you gone?
Doctor.
See, my friend. Yes. You are the county pharmacist?
Yes, I am.
Sasa kuja upande. Tumekufikia.
Please. I was asking.
You are the one in the position to answer Senator.
I was saying that there has been, I think for the last 2 years, we've been introducing a system that will monitor your drug entries and
exit.
And exit.
Yes.
Have you, because obviously that would help you achieve your numbers in terms of the quantities, what is going faster, that would even show you which diseases are.
Very true.
Yes.
So the level 5 hospital where we have,
yes,
where we are, already had a system
okay,
that is used to manage, that they used to dispense, that tracks everyone who comes in right from the entry point
yes,
to the exit.
So you have it. Am I died?
It is there.
It is there.
But
It is
now
working.
It is working.
Okay.
The only thing is, we are now about to acquire another one.
Okay.
Another system with more.
The government one.
No, not that one.
Okay.
But then, as we are going to do that, then
Yes.
then this one now again.
Oh, okay.
The Taifa case.
Yes.
Unfortunately, so far, it has only been rolled out in the level 2s, 3s, and a few level 4s.
Yes.
For the level 5, the DHA informed us that they are making a specific one for
Okay.
level 5 and 6.
Okay.
So we are still waiting for that one.
Okay.
So you are still using your old system?
Your old system.
Is it working?
Yes, it is working, but it lacks the
That's all.
inventory.
Hold on now. So where
Yes.
do you enter? Where is your system here, madam?
We actually use manual recording. For dispensing is what we use the system. Yes. Yes.
But it is so easy to use electronic too,
Yes.
and that is why if you look at all these medicines, each
And
one
you know
of
you're
them.
also, you're also dispensing from here to the other family.
Exactly.
Yes, yes. But now we, like you can see, we have a lot of
That's
paper.
why that's what
We have
we
a
are
lot
saying.
of paper, while I need a system.
That's what we are saying.
Yes,
The team is here,
yes.
and I'm asking not you. Where is the med soup?
Yeah.
Thank you, sir. Do you think it's possible that you will introduce the system which needs to dispense, analyze the data, and even place the orders that you need?
Through the chair, there has been a process of rolling out the Taifa Care,
Yes.
and that made it a bit odd for us to start acquiring another system or even upgrading the current system that we have.
But he's saying that you're being told that level 5s will have a totally different system outside the Taifa Care. I don't even know why.
It will still be a government.
Oh, it's a government system.
Yes.
Will they be both be integrated? No.
Well,
They should.
the information we have is that this system is going to be integrated with SHA. It's like a super highway.
Now, what we are trying to look at is,
Yes.
you know, as a county pharmacist, you are responsible for all facilities
Yes.
from level 6 to level 1. It would be your interest as a county pharmacist to monitor the
Buy from wherever.
But first place of call is the KEMSA. 'cause
Yes,
it's
that
better
is
than
true.
nobody.
We know that. What we are asking is, so far, are you comfortable with them?
Yes.
Okay. Number 2, what is your electric bill in this whole facility per month?
That's
It's around 7 million.
So in a year, you're talking about 100 million.
90.
90. You know that if you did a solarized system in this place, which is 4, right? You wouldn't spend even 20 million to do.
Well, we started with the bottles, so we are hoping.
The reason I'm asking, all these lights are here. We are here because
Especially daytime lighting.
will discourage peaceful. I want to check.
Tuende nikuoneshe. It is iko in my office.
But before we go,
Yes.
can I check one of your bin cards? Where are your antibiotics?
My antibiotics are here. We are in the process. Tarehe 6 mwezi wa 4. I have a clerk who does the work. Na ndio hizi tunaendelea kuupdate. We are the ones as pharmacists.
Remember there before we used to use oxytocin. So with the introduction of the habitocin now as a management, that's the new labor, we did capacity building.
Really not practical in our dispensary, but in a store, that is the
where is your store?
that one
This one is there.
But because of many products in small space, it's usually cumbersome to put your documents. So we have a folder. Every month, I can only speak for pharmacy, but because that is one of the drugs
She
that
has
is
told us, don't
required.
answer.
Oh, yeah.
No, but I want to hear you from you.
You can hear from me. Why we are from our facilities, we are the major referral. So Kabetosin actually works for the patients who had more or 2 operations better. And those cases are running in our hands. So we'd rather have, because either party or the person will have to find that patients here. So we are the first contact for that drug because those patients have high risk of bleeding. So that's why we find this around.
Are you prioritizing because of the historical cases, or are you prioritizing because the medicine is expensive and you have to make decisions based on the cost?
Not the cost.
Yeah, it is purely on merit.
On merit.
Okay.
But the question we're asking is,
Yes.
the other facilities are also
They have cases
Cases.
because many of the children are dying there.
is expanding maternity services. Number of facilities, that's the benefit. Don't worry. She has answered, but it's contradictory information.
Excuse me, Chair.
And we told you it's a
Around 5 at most. The county's preterm pregnancy ratio is 22% of all the mothers that attend antenatal care in our facilities. And our mortality ratio, the facility mortality ratio for NCTRH is 25 in every 100,000 mothers.
Yeah, we were in the process of automating, but then we were told that
My advice.
Yes.
Unajua shida yetu serikali ni tunatakanga ni kama tuna invent the wheel. Naja.
Yes.
If you go to these private facilities, see their stocks are monitored from. Sasa wewe unaona wewe unaitisha empty bottle.
That is also a requirement even in the private. You have to have evidence that you finished for you to be replenished.
If you really, you have to be real time on checking the stocks. Well, don't you think it would be better to automate? And my advice is this. You know, ICT systems, you can, there are so many people who look at the private facilities, public facilities are working system, just know where was the system from, how are the specs, come and deploy the system on answer points. Kwa sababu sasa hii tutaanza kufanya fiscal count. Sasa hapa tutafanya gani? Kuna gani?
Yes, we have been.
What was the name of your drug?
Kabetosin.
Nataka kuangalia hiyo ya kabeto.
Okay, good morning. Assist checking, I'm a deputy in charge of the maternity theatre. So far, they're operating so many patients who have been operated before, 2 or 3 times. We used to use a lot of oxytocin, now we are not using. We actually, for the last 1 year or so, we have not been ordering. So the drug is there and it's really working well. Thank you.